Hi, Dr. Osborne here with Gluten Free Society and Web Wellness University. Today I want to talk about an exciting new research study that just was published in the Journal of Experimental Medicine, where doctors discovered a new mechanism by which gluten can create damage to those with gluten sensitivity. And so what's important to understand is that to date, there are only a few known mechanisms of how gluten can impact a person's health if they have a gluten sensitivity or have celiac disease. The oldest way, or the most known or well-established way, is that gluten can induce an autoimmune disease. And what happens is a person will make antibodies to a couple of different things. One, that should be a G. One is anti-tissue transglutaminase, and the other antibody is called an anti-gluten antibody. And so these people will start to create antibodies, and those antibody contributions will lead to an autoimmune reaction. And most notably, we identify or diagnose that as celiac disease by measuring a biopsy to determine whether or not there's damage to the small intestinal villi. So that's the oldest and most elucidated mechanism by which we try to make a diagnosis for celiac disease. It was also discovered that gluten can cause intestinal permeability, otherwise known as leaky gut syndrome. Gluten actually damages proteins within the cell linings of the intestine and breaks them apart and allows for gaps to appear within the gut lining or within the epithelial gut lining. And that leads to leakage of food proteins and bacteria and viral proteins through into the bloodstream and directly into the immune system, and that can create different types of reactions that are detrimental as well. But in the Journal of Experimental Medicine, the research study just elucidated a new mechanism. They found different molecules in wheat. Those molecules are called alpha amylase trypsin inhibitors, or ATIs for short. And what they found is that these molecules induce a different kind of damage through a completely different pathway than what has previously been identified. So traditionally we have this antibody response, but what these ATIs do, these ATIs actually create an intestinal inflammation, but they were also found to create a non-intestinal inflammation. So not only do they contribute to or potentially can cause celiac disease, but they can also cause what we would call extra intestinal manifestations. So when a person eats gluten and they develop neurological damage, or when a person eats gluten and they develop a migraine headache, these are other forms of gluten-induced disease. And one of the new mechanisms identified is this alpha amylase trypsin inhibitor. And so this is a very, very unique finding in that it gives us another tool or another mechanism to identify how gluten can cause or create damage. And it gives us a validation for many of those people who have seen a doctor, not been diagnosed with celiac disease because their test came back negative, but actually do better on a gluten-free diet. It's just that doctors don't measure this particular mechanism. So I hope you found that this was helpful for you. Share it with your doctor, share it with your friends. As Dr. Osborne with Gluten Free Society, have a very Merry Christmas and Happy New Year.